Okay, so with the physical preparation, it's just like the normal physical preparation that you know. So your catheter, you pass your catheter, remove dentures where necessary, identification band, and then personal hygiene. Ensure that patient has taken care of the personal hygiene, mouth care, bathing, etc. Bowel preparation, so you encourage patient to empty the bowels the day before the surgery. Bladder preparation, so catheter is passed, patient is allowed to empty the bladder, and then you pass catheter. Jewelries, if present, is removed, right? It's done around the neck, so if when necessary you wash the area with soap and water, and then you shave the area, so around the neck, the beard, all that, right? And then before patient is taken to the theater, so gowning, etc. Right, before patient is taken to the theater. Let's look at the additional post-op management. Additional post-op management. So with the post-op management or nursing responsibilities, most of the time the other management where you check the level of consciousness, vital signs, side wheels, all of them will be done for this patient. SpO2, oxygen, suctioning where necessary. Right, the dressing is at the anterior part of the neck, so you assess for bleeding, right? And because it's at the neck, most of the time when patient is bleeding, it can go behind the neck, right? So it means that as a nurse, you have to put on gloves and then pass your fingers around behind the neck too, so that in case you detect any bleeding, you can report. Right, and then apart from that, you have to also assess for signs of pain, right? So you assess the pain level, give prescribe analgesics, prescribe antibiotics, right? Vital signs like any other surgery, and then also assess for signs of respiratory distress like restlessness, cyanosis, dyspnea, etc. Right? And then if they are present, your SpO2, your oxygen, signs of laryngeal nerve damage, right? So you assess the speech. And most of the time it's possible for them to have loss of speech, but gradually they will regain the voice. So you have to explain to the patient. And then tracheostomy tray is left beside the bed, right? Which is so that in case of any airway obstruction, tracheostomy can be done by the surgeon. And then apart from that, you assess for signs of tetany like muscle spasm, twitching, irritability, numbness of the or tingling sensation of the nose, the earlobe, the toes, the fingers, right? And then you assess for Vostex sign where you tap the facial muscles for spasm, and then Trozo sign where you use the calf muscle of the BP. You occlude blood flow for some time and then see whether there will be spasm of the fingers, right? And then signs of tetany, we've talked about that. You have to make available calcium gluconate by the patient bedside so that if there is